Good afternoon, good morning, good evening. I am Dr. Fred Jones, and I am here with Ester Davis Television and the Black Media Social Group of Dallas, Texas. So we're featuring our millennials who have complete access to Twitter, Facebook, Instagram, LinkedIn, and so we also want to bring them in because what we're trying to do here today with our second recording is to continue to bring you information and direction about the COVID-19 virus that is running ramshackle over our communities, particularly of communities of color. So we have to get this information out to you. We have to make sure that it's accurate. We have to make sure that you understand how you can make better informed decisions. And that's why we're here today. This is very, very critical. Also, today marks the first day that you're supposed to be wearing a face mask while you're out in public, particularly when you're going to grocery stores and public venues and spaces like that, which is why we are in our face masks, to demonstrate to you as they move around and my glasses get foggy and all the other things that we have to deal with face masks. It's going to be the new normal. So we might as well get used to it because not only does it protect you, but it protects others. And it's just something that we're going to have to do. It's just part of what the life is going to be like going into this next year or year and a half or however long it's going to be. So today, we are pleased and honored to have former Director of Dallas Health and Human Resources, Zack Thompson. I've known Zack for about almost 30 years now.
Long time.
And I met him prior to him obtaining that position of the Director of Health and Human Services. I met him when he was actually working down in the trenches with Leonard Long.
That's right.
In the West Dallas area.
Yeah.
And so Zack has been around a very, very long time, and we wanted to get his perspective as we bring in different voices for you to hear, different ideals and different solutions. So with that being said, I want to introduce formally Mr. Zack Thompson. We want to welcome you here to Ester Davis Television along with the Black Media Social Media Group. So tell us what's going on with you, what you've been doing in your retirement.
Well, thanks, Fred. And the key point that I've been doing is a lot of traveling, but I've been volunteering. And so I've been volunteering down in South Dallas and working at volunteering at a food pantry to support. Even though I'm retired, I want to make sure I'm still doing things in the community.
Right.
And it's a great opportunity. I see you down there in terms of the involvement, being on the board. And so it's just great to be still active. So I'm on the ground still in the capacity of supporting our community.
Okay, so let's just get right into this because we have a lot of ground we have to try and cover in a short period of time. What is your assessment of how the virus is being dealt with? What is your perception on how the information or the lack of information is being disseminated to the community? And what are some of the things that you feel we need to do better or improve upon in order to get a handle on this particular virus?
Well, it's a good point. And since you have your mask on, I'm going to take mine off for a second because you're protected.
Yes.
And so the concern going forward is the pandemic. Most of everyone should be aware is that the United States has been planning for a pandemic since 1999. And in 1999, they put together a strategic national stockpile. And in that perspective, they were supposed to have N95 masks, all the protective equipment that is needed. And so we went through the pandemic training. We went through H1N1 in Dallas. We went through Ebola. And what I find amazing is that during the Ebola scenario, it was Dr. Perkins and myself went over to Mr. Duncan's apartment and went inside. We were the first ones to go in there. Everybody else kind of came after. We were the first one, and we issued the order of quarantine, and I'm bringing it to 2020. That was an issue of quarantine. And in that quarantine, that family could not leave that apartment for 14 to 21 days. And the issue that came out of this quarantine is that 2 nurses were allowed to travel throughout the United States who were actually in the room with Mr. Duncan when he went into the hospital. So I want to make sure I'm paralleling this. The family of Mr. Duncan had to be quarantined. The nurses who were in the room could go about their business. Later on, what we found is that Mr. Duncan's family, in the Ebola scenario, were all negative.
Right.
We found 2 positive nurses. So let's fast forward to 2020. We now have a pandemic that initially, however we want to get the spin, it's not about Democrat or Republican, it's about the facts. Is that African Americans were going to be left out in the process because, one, and I have to be very frank, when there is no African Americans at the table from a medical or public health standpoint in the discussions or the planning, then there's going to be what we're facing today. Give you an example. Since there is no vaccine, then what are we doing? We're dealing with a 1918 model of social distancing. They're saying we got to be 6 feet apart. That's a 1918 public health scenario that worked.
Which was with the Spanish flu.
Spanish flu. For you historians out there, how many people could have been in Dallas in 1918? Most of us were on farms. Most of us were, the population was small. I'm not going to count the East Coast cities. And so that worked. Now, fast forward to 2020, you tell people now you have to shelter at home, but then you make exceptions for essential services. The essential services are grocery stores, of course we need those, and other things. But what's impacted is that African American businesses are not essential, and so they're impacted. So let's look at what we have today. I want to make sure, and again, I want to thank Dr. Esther and Fred for even inviting me to kind of talk about this subject. Right now, and this is today, or yesterday, April 17th, there are over 2,000 confirmed cases in Dallas County of the virus.
This is as of
Today.
yesterday's statistics.
Yes. And so you've had 55 deaths. When you look at the breakdown, and this is their data from Dallas County Health and Human Services, you see the majority of the cases are African American and Hispanic. And so when you look at the 2 testing sites that were set up, one is, they're going to say Ellis Davis, and they're going to say the A Center. And you're going to say a drive-up testing site? When, as you know, in South Dallas, most of the people we see don't even have cars. So how realistic and how serious are you with a public health response when you don't take into consideration there should be walk-up clinics? And there should have been 2 scenarios. One, and somebody's going to chime in and say, well, they don't have enough testing testing equipment.
Right.
Okay, here's the concern. They knew that from day one. So you should run a parallel. One, those who are showing symptoms, which is what the drive-through could do. And then here's their data. This is the national data. 80% of Americans are asymptomatic, meaning they ain't gonna have a symptom at all, no symptoms. But 80% is walking around, or a percentage of those individuals are walking around who have the virus and are contributing to spreading the virus, but you don't test them till now. So all I'm saying is that I'm not going to ever Monday morning quarterback anybody, even though I got enough of it.
Yeah.
But I'm going to say this. If you're going to run a public health response, then run it where it takes into consideration low income, people of color, and a drive-through perspective of a clinic doesn't work.
This is exactly why, and I'm going to take mine off while you can put yours back
Okay.
on, because no, seriously though, this is exactly why we're bringing this type of information to you, because we know that when we go back and we look at pandemics, and as Zack has talked about history, when we talk about from 1918 until this particular point, which is a little over 100 years, we know that people of color have always been excluded because we've never been considered essential as a race. And so if we're not considered essential as a race, then when these particular conditions occur, then naturally we're going to be ostracized and left out. But let me ask you this, Zach. Through our discussions on social media, amongst ourselves, we're hearing about pre-health conditions that are exacerbating the situation with the virus. How does that link into what's going on actually, what we should have been prepared for, and what do we do going forward with this? Because we can't continue to say, yeah, we have this virus, yet we are unhealthy. So how do we correlate those two?
Yeah, I find it amazing that they're still talking about health disparities and they're giving out old stats and they're showing African American. I was born and raised in Dallas. You don't ever have to tell me about 75216, 10, 15. Those zip codes have been high risk since I've been born. So what's different? The difference is you have to get on the ground and go into those communities and deal with diabetes. They're showing in their own data the large percentage of those with this virus have diabetes. Okay, that's African American, that's Hispanics. We know that. But how many clinics do you actually have in the southern sector? How many walk-up facilities or outreach workers? Now I saw somebody say, well, we got outreach workers going out in the community. Or when did they start and where are they? And the point is, they need to be outreach workers that live in the community, that look like the community, and are going and doing the education. That's what's going to take us to the next step. High blood pressure, diabetes, we already know that's what we're dealing with. People always used to, I don't even know why they criticize, we used to do the immunization clinics, and we had a line wrapped around the building, and people say, well, they got those kids and the parents out there. Okay, this was their medical home, because the majority of those families had no medical home. They don't have a doctor. And so when you're looking at a public health model that we're looking at right now, that's based on a Highland Park model. That's based on some high income model. That's not based on looking at the community. When you looked at toilet paper, why did we run out of toilet paper? The virus doesn't cause diarrhea. Okay, so when you look at it, the information, so one day you wake up, they're saying, okay, we have a problem. Then the next day we shutting it down. That's not how you do public health. You gradually walk into it, educate, and that's what we used to do. Spend time educating the community. I heard a lady say the other day, and I might keep my mask on, I may not, just depends on how I feel today, but I'm gonna make a point. I hear elderly people say they can't find a mask.
You know what we're gonna do? We're gonna break for just a second here, then we're gonna come back and elaborate on the point of availability for these particular PBEs in the community. We'll be right back.
Hello, I'm Deatra Childress, the president of the T. Mathis Hawkins section of the National Council of Negro Women. I'd like for you to join us in making sure we get the word out to our community about what we need to do to survive this virus. Please come to our meeting, first Saturday of each month, at the Holy Cross Catholic Church on Bonneview Road at 4 p.m. We look forward to you joining us. Thank you.
Character, hard work, and compassion are three things that our law firm stands by. We believe in giving you individuals with the best of character, those who are honest, operate with integrity, and are committed to your case.
We strive for excellence in everything we do. We want to ensure that our clients are successful, not only today, but in the future as well.
Hard work. Our team is committed to giving their best effort on your file whenever they're in the office and when they're out of the office thinking of you and your claim.
Assisting our attorneys, our paralegals work to ensure that your customer service needs are met. We promise to work on your case in an efficient and timely manner.
And compassion. We're committed to giving you a team that treats you like family. We're together in this action, and we're committed to making sure that you always understand that we care.
You put your trust in a firm who will handle your case with compassion and care. We plan to develop a relationship throughout this process. Your goals become our goals.
Thank you for giving our team a shot, and we're committed to being there for you. God bless.
We're back. Dr. Jones here with my man, Zack Thompson former director of Dallas County Youth and Health, Human Resources. And we were concluding, or we're getting ready to get back into what you were saying about the elderly not wanting to wear masks. And then we're going to kind of bridge that into what's going on with our millennials and their desire or no desire to wear a mask, or how they don't take this seriously. And then before you just say that, I just wanted to say that our granddaughter, we were talking to her last week, and my wife asked her, well, do you have your mask? Are you practicing social distance? And she said, no, we don't do that. What do you mean we don't do that? What does that even mean? So basically, you need to stay away from us, so we'll see you on the sidewalk, or we'll wave to you. Because if you might be a carrier and you don't even know it, so you're going by your grandparents, you're going by elderly people. We know that this is taking out the elderly like nobody's business. Everybody, I'm talking to people right now who have been directly affected by their parents going to church, because churches have been not following these rules, because part of spirituality is being disciplined and obedient.
That's right.
Okay, and trusting in those people that have been entrusted to give us the information that we need. So Zach, with that, you can conclude, my brother.
Well, I'll wrap it all up into one. The reason why we should wear the mask, as you pointed out, when you look at the age groups, now I want to make sure, and that's good the school is shut down, because children can get it as well in terms of the virus. But also the majority of the cases in Dallas County have been between the ages of 41 to 64 years of age. Now, why we should wear the mask is because, as you pointed out, diabetes, lung disease, heart disease, kidney disease, cancer, immune deficiency, those are the kind of things that really point out why you should wear the mask, to protect those individuals. So why I wear it is to protect you as well as me. But basically, the elderly are concerned because they can't find masks. You're asking them, so there should have been something set up to provide masks to low-income residents. Then you do a demonstration on making them. Okay, the ones they're making, I have an N95 mask right here. That's 99%, 98 to 99% effective. Any other mask doesn't have the efficiency as an N95 mask. You can't find it. Somebody told me over here in Oak Cliff, they saw a N95 mask for $10. That's one mask. You could go to Home Depot for all the pandemic and get a box for $10.
Yep.
So what I'm pointing out is that if the reason to wear the mask is to protect our high-risk population and our seniors. And so I support it from that aspect, but we're saying wear something, but it's not effective just having a bandana on. And so if that's all you have, then that's fine. But I'm going to have to ask public health departments throughout the United States. And I have to agree with one person we normally don't want to agree with. Where did all the masks go? And now when the masks that we need are all coming from China. So what's amazing, I have to take from a famous city council person, it's amazing as in grace. How the heck can you talk about having masks and now there is no mask? And personal protection equipment, if you remember what happened during Ebola, the two nurses, that was their issue. This guy had trajectory, diarrhea, and vomiting. So why is this new? So you see people saying, well, we don't have the equipment. We said that in 2014. We said that in 2008 in terms of the H1N1. And now we're still talking about in 2020, protect our first responders. Now we had a situation, let's bring a recent one. Downtown with a homeless shelter. They got 38 cases or more, plus the employees. You also may have 2 Dallas County Health and Human Services employees who may be quarantined because of this. You don't hear anything about the individuals who are impacted by this. And then I see in the news where when they went to pick up the homeless, the bus driver had on all kind of covering. He was shielded. And so the reality is, if to wear the mask is to protect those who are at high risk and to protect you. last piece I want to make sure, because we got to cut. It's a lot of ground in
Lot
there.
of ground.
Here's how confusing it is. First they say it don't make sense to wear a mask.
Right. Yeah.
Now they saying wear a mask. First they were saying we got this under control. We're about to hit the peak. Now, let's don't take our foot off the gas now. Now when they tell you they got 2,000 cases, well, we just said 80% of the individuals are asymptomatic, no symptoms. Meaning that when you go to the doctor, first thing the doctor said, what brought you here today? You say, Doc, I got a sore throat. Oh, he ready to go then. A sore throat. Oh, okay, let me look in your ear, let me look in your throat. Okay, I know what, okay, I give you an antibiotic or whatever. You go to the doctor and say, I'm just here, I don't have any pains. Watch what he or she gonna do. Well, we gotta run a blood test or something to see what's going on with you. 80% don't have symptoms. They're walking around. So why wouldn't you test a sample? And don't tell me you got a small number of testing equipment to do it. There should be more testing. There should be not only for those who say they have the symptom, but those who do not have the symptom. And you would have captured this. When you look at the numbers, and this is their data. When you look at how many African Americans, in terms on April the 16th, they say in terms of patient count, there's 350 African American, Hispanic 492, white 362. This is showing those individuals who are reported cases who are minorities. Okay, well let me ask a question. Have anyone of y'all seen any outreach workers come into the African American community? I'm in South Dallas, not just that one day, almost every other day I'm in South Dallas. I don't see anybody. Matter of fact, if you drive down, they don't call no business names, but if you drive down, we used to call it Oakland, I guess it's called Malcolm X. Hey, they standing out in line to one of these stores.
Hey, but they're doing some social distancing at that one of those stores. But there is nothing. We can go down there right now, take some testing right on Malcolm X, right on MLK in Pennsylvania, right on Home Street. We can capture a whole bunch of folk and get them tested. We can get a whole lot of people, and they're not getting tested.
And that's what an outreach worker who was on the ground. I know they're not taking the playbook from 2014 and Ebola. I'm gonna tell you why. Nursing homes should have been the first ones to have been identified. Okay, so when everybody tell you, and that's why I know sometimes I feel like coming out of retirement, but guess what?
No.
Hey, my point is this. When I look at it, I'm like, okay, 2014, you go around to the high-risk areas. They called me during the Ebola situation, said a man spit on the dark rail line. They stopped the rail line. I said, okay, then you can start it back up, because the man don't have Ebola. In this scenario, if you're going to go with public health response, you go with the high-risk populations. And the last thing I'm going to say, and this is something I am going to write about, why is it that when I want to find Lysol and other things to protect me, I got to go north?
We don't have it. We don't have it.
Lysol wipes, anything, Clorox. I gotta go north to find that. So I'm getting confused. So now we got all these elements: diabetes, heart disease, and then how many of these individuals? And I commend Commissioner Price for standing up and challenging that. And we got a balance between the public health and the economics of this situation. And right now, we're getting hit both ways. And that's why I agree, pick your poison. You got the same issue. But at the end of the day, the problem is, what's going to change? Because, and I have to be frank, if they don't look like us, how many African American doctors are in this discussion about the public health planning response in Dallas? How many African American Hispanics are in the discussion about even the economic response to this? So that's why I get a check every month, so I can say this. That's why I got a problem with all of this, is that I don't have a problem with what they do. I got a problem with what we doing, and that's nothing. Because who are the experts they consulting with? Dr. Davis, no, in everything you deal with, you see other people on these committees, but nobody look like us. So who's gonna bring the perspective? So who's gonna mention in the meeting If there is no African American, there is no Hispanic, that you need to do something in South Dallas. Now they say they're gonna do something in Pleasant Grove with a Walgreens. Well, I'm gonna say you need to be doing something in Oak Cliff, South Dallas,
East Dallas,
East
West
Dallas, right? And then not only DeSoto, they showing DeSoto as one of the highest numbers, but they don't know why. Okay, then you got Cedar Hill, and you got all the African Americans who have moved out there. Nobody has been
Lancaster.
right.
Yes.
So nobody is
Yeah.
out there. So I'm gonna say this: they say what they can about me. I'm not drinking from that Kool-Aid.
That's why we brought you on board. Because at Esther Davis told we've done this for 30 years with the millennials, with the black social media. We're going to tell you what it, because what are you going to do? There's nothing you can do. We're going to tell you what you need to hear and why you need to hear it. You know what? We've reached that point now where we're going to take another little break, and then we're going to come back and close it up. But if you're on Facebook Live, you need to pass this on to your friends. You youngsters out there, y'all need to heed this, like I said. Now, the brother from the Surgeon General, when he said it, it ain't come off right.
No.
You see, it ain't never the message. It's always the messenger.
Yeah.
Okay? That's why we got him as a messenger. That's why I got Brother C.W. Whitaker here because he's a messenger. That's why I got Esther Davis, how we got the millennials, myself. We are messengers that have been out here in the community, and we're not going to lie to you. You can trust us. Trust is a major, major issue, and so I'm going to use that and when we close out. But we're going to go to another close out here, another segment. Then we're going to come back and we're going to conclude. But we're just glad to be here. Well, again, I want to thank Mr. Zack Thompson for being here and giving us his honest, unabashed, unafraid perspective.
Character, hard work, and compassion are three things that our law firm stands by. We believe in giving you individuals with the best of character, those who are honest, operate with integrity, and are committed to your case.
We strive for excellence in everything we do. We want to ensure that our clients are successful, not only today, but in the future as well.
Hard work. Our team is committed to giving their best effort on your file whenever they're in the office and when they're out of the office thinking of you and your claim.
Assisting our attorneys, our paralegals work to ensure that your customer service needs are met. We promise to work on your case in an efficient and timely manner.
And compassion. We're committed to giving you a team that treats you like family. We're together in this action, and we're committed to making sure that you always understand that we care.
You put your trust in a firm who will handle your case with compassion and care. We plan to develop a relationship throughout this process. Your goals become our goals.
Thank you for giving our team a shot, and we're committed to being there for you. God bless.
Hello, I'm Deatra Childress, the president of the T. Mathis Hawkins section of the National Council of Negro Women. I'd like for you to join us in making sure we get the word out to our community about what we need to do to survive this virus. Please come to our meeting, first Saturday of each month, at the Holy Cross Catholic Church on Bonneview Road at 4 p.m. We look forward to you joining us. Thank you.
Dr. Davis and Fred, thank you for the opportunity to talk to the community, and I want to reiterate, your health is your wealth. You can have money, that's going to fade away. You can have fame, that's going to fade away. But when you're laying in that bed, sick, you're going to realize how valuable your health is. And so I'm asking you to wear the mask for your health. We're already at the bottom in so many areas. We can't fight if we sick, whether it's man-made, biological, however it came about from an animal to human. So your health is your wealth, and I'd rather have my health than $1 million because I know I can do things. But I could have $1 million and be laying in Parkland Hospital and it'd do me no good. So remember that, fight, write, communicate what your concerns are. I told a group of young men today, while you stuck in the house write about your feelings. And the mental health, I want to make sure I'm clear. When you're sitting in the house and you're looking at this on the news and you're saying, I'm depressed, you know why you're depressed? Because you hadn't wrote a letter saying, why is there no Lysol in the southern sector? You know why you're depressed? Because you haven't wrote to say the liquor stores can be open, but the church is closed. I'll tell you how to get your mind right. Exercise your ability to tell people about your pain. Thank you for it.
We're going to close this out. We can't make you do anything. You can lead a horse to water, but you can't make him drink. You can listen or you cannot listen, but we're going to tell you the truth as it stands. The realization is that from 1918 to 2020, the same situation is still here. That lets you know that the system is not attuned to keeping up with the problem. It never has and it never will. We have to save ourselves. Save ourselves. Because one thing that I always tell my wife, when we're kind of working out, I'm saying, you have to be able to save yourself if the car ever goes in the water, or if you have to hang on till somebody comes to get you. If you don't have the strength to hold yourself up, if you don't have the ability to swim or to hold your breath or to do whatever it is, you're going to die. So what we're telling you right now is you need to figure out a way to save yourself. If you need to change your diet, change it. If you need to change your mentality, change it. Whatever it is you need to do, you need to change it. You need to instill that in your children, and you need to instill that in your community, because the community has to survive, and it's not going to come from above. It's not going to come. The Lord's got us. We got that, but the city doesn't necessarily have us, or in the state, in the country. Save yourself.